Hello everyone, this is second video series on parathyroid gland. Question number 1 is which of the following is false about secondary hyperparathyroidism? Option A occurs as a result of chronic kidney disease. Option B high phosphate level and low vitamin D is seen. Option C low phosphate level and high vitamin D is seen. Option D none of the above. Answer is C. Explanation is secondary hyperparathyroidism is a condition where parathyroid glands overproduce parathyroid hormone in response to low blood calcium levels, most often caused by chronic kidney failure. This overproduction leads to hyperplasia, enlargement of the glands, and an increase in parathyroid hormone to try and raise blood calcium levels. Its features are high levels of parathyroid hormone, high levels of blood phosphorus, low or normal blood calcium levels, low levels of active vitamin D. तो जो पॉइंट मैं आपको इसमें समझाना चाहता हूँ वो ये बात है कि सेकेंडरी हाइपरपैराथायराइडिज्म में हाई लेवल्स ऑफ ब्लड फॉस्फोरस और लो और नॉर्मल ब्लड कैल्शियम लेवल्स देखे जाते हैं और प्राइमरी हाइपरपैराथायराइडिज्म में लो लेवल्स ऑफ ब्लड फॉस्फोरस और हाई लेवल्स ऑफ ब्लड कैल्शियम देखा जाता है। तो अपने को जो मेन पॉइंट जिस पे फोकस करना है वो कैल्शियम और फॉस्फोरस लेवल है। इसी के बेस पे हम प्राइमरी और सेकेंडरी हाइपरपैराथायराइडिज्म में डिफरेंशिएट कर सकते हैं और जो मेन कॉज है सेकेंडरी हाइपरपैराथायराइडिज्म का इज़ क्रोनिक किडनी फेलियर। Question number 2, which is false about calciphylaxis. Option A, it is also known as calcific uremic arteriopathy. Option B, painful skin lesions are seen. Option C, risk factor is hypercalcemia and hyperphosphatemia. Option D, none of the above. Answer is D, none of the above. Explanation is calciphylaxis or calcific uremic arteriopathy is a rare and severe condition characterized by painful, slow healing skin lesions caused by calcium buildup in the small blood vessels of the skin and fat, leading to tissue death and potential infection. Most common in patients with end stage kidney disease, it also affects those with normal or less advanced chronic kidney disease. While treatable, calciphylaxis is a life threatening disorder with high mortality rates, often due to sepsis from skin infections. Causes and risk factors are the exact cause of calciphylaxis is not fully understood but is often linked to end stage renal disease and dialysis, problems with calcium and phosphorus metabolism leading to high levels of both minerals in the blood and elevated calcium phosphorus product. Hyperparathyroidism, a condition where parathyroid glands produce too much parathyroid hormone. बेसिकली कैल्सीफाइलेक्सिस कंडीशन है जो हाइपर पैराथायराइडिज्म की कंडीशन में देखी जाती है। इसके साथ जो एसोसिएटेड फीचर्स हैं उसमें रीनल डिजीज़ देखी जाती है जब कैल्शियम फास्फोरस का मेटाबॉलिज्म में डिस्टर्बेंस देखा जाता है जिसके कारण कैल्शियम और फास्फोरस लेवल इंक्रीज़ हो जाता है। जब कैल्शियम ये ब्लड वेजल्स में डिपॉजिट होने लगता है जिसके कारण स्किन में नेक्रोसिस देखी जाती है। समटाइम्स इट बिकम्स serious life threatening condition. Question number 3, which of the following is true regarding parathyroid carcinoma? Option A, loss of parafibromin and pgp 9.5 positive has high risk of malignancy. Option B, it is a very common malignancy. Option C, surgery is contraindicated in all case. Option D, none of the above. Answer is A, parathyroid carcinoma. Explanation is parathyroid carcinoma is a rare and exceptionally rare malignant tumor of the parathyroid glands, a rare and endocrine malignancy. Symptoms are often due to resulting severe hyperparathyroidism with symptoms including fatigue, weakness and neck lump and high blood calcium levels. The main treatment is complete surgical removal of the tumor which offers the best chance for cure. Parafibromin and protein gene product, which is PGP 9.5, are immunohistochemical markers used in diagnosing parathyroid carcinoma, which is a rare and difficult to diagnose cancer of the parathyroid gland. Complete loss of nuclear parafibromin staining is a strong indicator of parathyroid carcinoma, while PGP 9.5, a protein encoded by the UCHL1 gene, is highly expressed in parathyroid carcinoma and serve as a sensitive and specific complementary marker to parafibromin. Basically, parathyroid carcinoma is a very rare malignancy. First point, so option B is incorrect. And the main treatment part of parathyroid carcinoma is surgical removal of the tumor. और जो सिम्टम्स इसमें होते हैं वो हाइपर पैराथायराइडिज्म के कारण होते हैं जैसे कि फैटिक, वीकनेस, नेक लम्प एंड हाई ब्लड कैल्शियम लेवल्स। ये 3 पॉइंट्स और जो फोर्थ पॉइंट जो मैं आपको बताना चाहता हूँ वो ये जो पैराफाइब्रोमिन और पीजीपी प्रोडक्ट 9.5 है, इसमें जो पैराफाइब्रोमिन प्रोडक्ट का लो अमाउंट और पीजीपी 9.5 का हाई अमाउंट इज कॉजेज more chances of having a parathyroid carcinoma?
Question number 4. Which of the following is false about tertiary hyperparathyroidism? Option A. Persistent autonomous hypercalcemic hyperparathyroidism after kidney transplantation. Option B. Autonomous gland function. Option C. Progression from secondary hyperparathyroidism. Option D. Response to normal feedback mechanism. Answer is D. Response to normal feedback mechanism is false statement. Explanation is tertiary hyperparathyroidism is a condition where parathyroid glands become overactive and produce excessive parathyroid hormone even after the underlying cause of secondary parathyroidism has been resolved, often after a kidney transplant. This leads to high blood calcium levels and require treatment, which may include surgery to remove parathyroid tissue or medication like quinacalcate to control hormone levels. It develops after prolonged periods of secondary hyperparathyroidism, a condition where the parathyroid glands are stimulated by low calcium levels and high phosphate levels common in chronic kidney failure. मतलब कि जब सेकेंडरी हाइपरपैराथायरिज्म होता है जो कि क्रोनिक किडनी फेलियर के कारण होता है, जिसमें लो कैल्शियम लेवल्स और हाई फॉस्फेट लेवल्स होते हैं, तो बार बार रिपीटेड स्टिमुलेशन के कारण जो सेकेंडरी हाइपरपैराथायरिज्म की पैथोलॉजी है वो कन्वर्ट हो जाती है टर्शियरी हाइपरपैराथायरिज्म की पैथोलॉजी में, इसमें कि हाई कैल्शियम लेवल दिखा जाता है। इसको कंट्रोल करने के लिए हमको सर्जरी करनी पड़ती है या फिर हमको किनाकालकेट और ड्रग्स का यूज़ करते हैं टू कंट्रोल हार्मोन लेवल्स, और उसमें नॉर्मल फीडबैक मैकेनिज्म लॉस्ट हो जाता है। क्वेश्चन नंबर 5 इज which is true about persistent and recurrent hyperparathyroidism. Option A. Persistent hyperparathyroidism. In persistent hyperparathyroidism, elevated calcium within 6 weeks of surgery is seen. Option B. In recurrent hyperparathyroidism, hypercalcemia occurring 6 months after surgery. Option C. Both A and B are false. Option D. Both A and B are true. Answer is D. Both A and B are true statement. In persistent and recurrent hyperparathyroidism describes elevated calcium levels after parathyroid surgery. Persistent hyperparathyroidism is defined as the persistence of high calcium levels within 6 months after surgery, and recurrent hyperparathyroidism occurs when high calcium levels return more than 6 months after surgery following a period of normal calcium levels. These conditions are often due to missed or ectopic parathyroid glands or multiglandular disease, or a rarely parathyroidoptosis or parathyroid carcinoma. Persistent hyperparathyroidism, हाई कैल्शियम लेवल्स देखे जाते हैं within the first 6 months after surgery.
In recurrent hyperparathyroidism, high calcium level is seen 6 months after surgery.